Now, we do encourage that you submit your questions. If there's any questions that you may have or comments, please feel free to use the WebEx's question and answer feature, which should be located on the bottom right hand of your screen. Now, just a reminder, we will not get to those questions until the end of the webinar, but feel free to ask your questions during the webinar, but again, note that we will not get to them until we are wrapping up at the end. And again, if you have any questions that you want to direct towards Retail Council of Canada, my information is on the screen, so feel free to call me, email me, or on LinkedIn or social media avenues. I will ensure that I follow up. Now, before I introduce Bev Kobi, who is the Director of Mission Advancement for Goodwill Industries, Ontario Great Lakes, I had to say that I had a great visit. A couple of weeks ago myself, we had the Ministry for Seniors for Accessibility, so again, known as MSAA, previously known as ADO, the Accessibility Directorate of Ontario, ADO. I will refer to the Ministry for Seniors and Accessibility in this presentation as MSAA going forward. But we were there with the Parliamentary Assistant Daisy, myself, team members from the Ministry, from the MSAA, and Bev Kobi and her team. And I have to say, I was a press release where we were announcing all the great work that RCC has been privileged to do working with MSAA. And Bev Kobi was kind enough with her team to give us a nice tour and really the one-on-ones of what goes into a great organization like Goodwill Industries. And I must say, I was truly flabbergasted and floored just to see the amazing work and just the health and safety, the accessibility, the workers, and how Goodwill is living and breathing what we want to talk about today. So I'm really great, as our last webinar, to have someone like Bev Kobi join us to really do a deep dive on not just giving coaching tips and strategies on the importance of respecting mental health in the workplace, but they live it and they breathe it. So she will share real-life examples on what Goodwill Industries does today. So before I pass it on to Bev, let me tell you a little bit about her. Bev Kobi joined Goodwill in January 2008, bringing with her an extensive knowledge base with respect to persons with chronic and health concerns, having worked as a counselor in the mental health care program at London Health Sciences Centre for 20 years, so decades of experience. Bev has a youth counselor diploma from Fanshawe College, as well as a psychosocial rehabilitation certificate from Mohawk College, and more recently, a professional certificate in leadership from Western University. Quite the accomplishments, Bev. Lastly, Bev's passion for providing comprehensive services to persons with a variety of barriers, and her belief that individuals are to be given every opportunity to function as a contributing member of their chosen community has led her to grow from her vocational planning counselor role into the Goodwill leader she is today within our intensive and vocational employment services. Everyone, it is a pleasure to introduce our guest today, Bev Kobi. Bev, the floor is yours.
Thank you, Sunny. And thank you to the Retail Council of Canada for having me. It's a really important topic, and I do applaud the Council for the series of webinars that you've been hosting, so thank you.
Thank you.
Hey. So I've got the slides now, and I'm going the wrong way, right? All right. Okay. Workplace accommodations and mental health. So today we're going to look at, as Sunny mentioned already, mental health in the workplace. We're going to talk about the business case for accommodating workers with mental health challenges, and then specific workplace accommodations themselves. And throughout the session, we will touch on the return on investment for having an inclusive, accommodating environment. And my hope by the end of today's session is that you will recognize that truly to do nothing can be quite costly. I'm just going to take a little bit of time to chat a bit about Goodwill. Our mission is changing lives and communities through the power of work. Our mandate is helping people overcome barriers to gain access to work and reach their full potential. Our philosophy is a hand up and not a handout. And I do want to comment that accommodating an employee with a mental health disability is not about lowering your business standards. It's about making adjustments to ensure that your employee can continue to be successful in their work. So Goodwill Industries, we're a nonprofit registered charity. Our region is much of Ontario, excluding Hamilton, Halton, Niagara, Haldimand, Norfolk, Brant County region. So we have all of southwestern Ontario. We've expanded into the GTA. We have up to Tobermory, Ottawa. So we're a growing proposition. We have 15 retail locations across our region, primarily in southwestern Ontario right now. We have expanded, starting to expand into the GTA. We opened a boutique store in Newmarket, and we'll be opening a very large 25,000 square foot store in Mississauga in the spring of 2020. And then in addition to that, we've got 3 bookstores, an outlet store, 2 recycling depots, and 3 career centers. That's just a quick pic of one of our stores. So we train and develop people on a multitude of work platforms. And we have currently almost 900 employees, and we anticipate that our annual payroll will be at almost $40 million within the next 4 years because of our aggressive growth plans. Okay, so since the beginning of the last century, Goodwill Industries has provided jobs, skills development, career advancement for people who face disability, social disadvantage, and other barriers to employment.
And that's amazing information here, Bev. You know, you mentioned earlier that 900 employees, that's close to 1,000, and I like the word that you used, aggressive. So for our listeners today, let's get right into it. What does Goodwill do, and how do you do it?
Great, thank you. Great segue into the next slide. So how do we do it? How do we create this culture of caring, of learning, and acceptance? And we do it through a variety of ways. And to start with, we intentionally recruit what we refer to as mission hires. So we have a large number of staff that have barriers, primarily mental health. We also have, a bit of an aging workforce, so people that had physical disability now are also struggling with some mental health challenges. We've got a lot of anxiety and depression, and I hear that across the communities, with other employers as well. We have a team of employee coaches that support each staff person in whatever they may need. So primarily in the workplace, but also in their personal life. So the role of our coaches is to make sure our staff are connected to the community resources and supports that they need. So for example, counseling, a family physician, whatever they need to be stable and be successful at work. And the transitional support that we refer to is if any of our staff want to grow and develop and maybe work their way up in the company or work their way into a better job in the community, we support that. Our strategic plan actually identifies that 20% of our workforce will graduate up or out each year. That's something that we're committed to. So the big question, why accommodate? And in the previous webinar, we heard some staggering statistics from Lawrence Blake with CMHA Ontario. 500,000 employees are missing work every week because of mental health challenges. Mental health issues account for 30% of all WSIB claims and 70% of the costs. This is not something that businesses can afford to ignore. I wanted to talk about a catalyst study that the Mental Health Commission of Canada did in April 2018. So researchers took 5 Canadian businesses that are known to champion psychological health and safety in their workplace. They examined the costs and the benefits of accommodating 11 workers with mental health needs. The return on investment gained by both the employers and employees was analyzed then using case studies, and the study's analysis projected that these employers would realize a net savings of anywhere between $56,000 to $204,000 after 5 years. That's a twofold return on investment.
Bev, as you're sharing these metrics, and I really appreciate the reference to Lawrence Blake's presentation. So this is not just occupational, or sorry, not just non-occupational. You mentioned WSIB. It's also occupational, and I respect the comment that you made that employers really need to look at this and take this seriously. And your stat right now, the slide that we're looking at, that would realize a net savings between $56,000 to $204,000. What would you say to those people that still aren't buying, that still don't believe this is a value?
Well, I'd say start to do some research, because the statistics, the evidence is out there. There's some great resources, and any businesses you speak to who are actively promoting inclusion and they're accommodating their employees, talk to them about their bottom line. Talk to them about the impact it has had on their organization. And I appreciate the question, because now we can move in a little bit to the business case. Because there is some mention here about the decreased absenteeism, lower staff turnover, and I'd like to chat a little bit more about that.
Thank you, Bev. Yep.
Thank you. So the business case for accommodating workers with mental health challenges, improved attendance and less turnover become quickly obvious when you start to accommodate. Employees tend to be more engaged, they report better job satisfaction, and they have stronger retention rates. And then you start to see positive impacts to your bottom line. The return on investment is reflected in a positive culture, a stronger brand, increased productivity, because employees are feeling supported and they're engaged, and the result is a successful business. With accommodations, so as employers, we have the duty to accommodate, but supporting a worker so that they can be successful makes really good business sense. You don't want to underestimate the impact that this can have, not only to your individual staff member, but to your business overall. To support mental health in your workplace, it's important to have a mental health strategy, and that would include your policies around accommodation, accessibility, discrimination, return to work, and so on. Equipping your managers with skills around how to engage staff, how to listen, how to have those important conversations is really, really important. It's critical that managers are paying attention to their workforce. We can't afford to hesitate to have these conversations with employees that we have concerns about, simply because we're afraid that if we start asking questions, they may start to disclose some mental health issues. It's actually much better if they do share and if they're open about that, because then you can support them, you can accommodate them, and they'll have a better chance of being successful in your workplace.
You know, I like what you said there, Bev. Sorry about the comment of actually equipping managers and leaders with skills around engagement, active listening, and crucial conversations. And this quote that you have from Leah, your store employee, is just, wow, for the first time I finally believed I wasn't garbage. Goodwill literally saved my life. So, you know, first and foremost, at our Retail Council of Canada, we are very, very respectful with this, and hence why we work with the Ministry for Seniors and Accessibility, MSAA, to further coach our members and retailers, because you're right, Bev, you know, there may be some trepidation or some hesitance and resistance to actually talk to the workers and, hey, is everything okay? But can you expand a little bit on when you say equip managers, leader with skills around? So are you saying that Goodwill is actually takes and their managers and leaders and puts them through certain courses and et cetera, so they're receptive to that? Is that what you're saying Goodwill is doing, that you're investing in your leaders so they're, if and when the situation comes, they know what to say and they know how to react? Can you comment on that?
For sure, I can. That is part of our vision and our planning is training to really support managers, assistant managers. We have team leads as well in our retail sites that also have access to the training. So we're just developing our Goodwill University, which is an online e-platform, and so we have various modules that a manager or an assistant manager can go into at any time and do some online learning. I will get into a little bit more, some specifics, but mental health first aid training for your managers and your assistant managers is very valuable. Assist training, that's specifically for supporting staff that may be feeling suicidal. There's some really good, very accessible trainings in your communities that just give your managers and your leaders confidence, so that I think a lot of times we avoid conversations or we avoid addressing situations because we ourselves aren't comfortable with the conversation. And so it's not an easy thing to talk about, but if we genuinely care about our staff, we genuinely care about our teams, then we should have that responsibility and that accountability to one another. So yes, absolutely.
Right. And before you move on to your next slide, Bev, and thank you for that, you know, what I really want the listeners here to hear what Bev is saying is there's one thing of saying, hey, managers, leaders, you have to make sure you're engaging. You got to make sure you're an active listener. You have to make sure that you understand when there's a crucial conversation. Well, that's all great. Thanks for letting me know. But then actually investing the training, just like you would train someone on a forklift, just like you would train someone when they get hired in their workplace, you're training them to ensure that they are set up for success.
Thank you for that, because it's not a skill set that everybody has. It's not a natural ability that most of us are equipped with. We have to train ourselves and normalize it as training like any other kind of standard procedure that we would have. Yeah.
Right.
If you can have a company where everyone cares about the company, they care about the work they do, they take pride in their work, and they care about one another, your bottom line will be impacted positively. And that's that corporate citizenship or active citizenship you will sometimes hear people refer to. So, yeah.
Right, and perfect example, and I'll pass it back to you to continue your presentation. Just hearing what you're saying, you have a worker that comes up to you and says, you know, hey, I'll use myself as an example. Hey, Sonny, I have a mental health issue, or I have an issue that I'd like to discuss with you. Just that sentence alone, how you respond, it will really dictate where that conversation is going to go. So that training furthermore empowers, encourages, and teaches you to be aware of your body language, how you're responding, et cetera, right?
Absolutely. Yes. Thank you for that. So mental health accommodations, I think when we talk about this, it's important to be aware that not everyone with a mental health impairment will need accommodations in the workplace. Many don't. And those that do, they only require one or two, very minor adjustments. So I do think there is still this perception that accommodations are costly or they're time-consuming, and that really just isn't the reality. I've got some examples here, but there are so many different ideas about ways you can accommodate someone with a mental health challenge, and it's really very individualized. So again, that's where that having the conversation, asking the open-ended questions, really engaging your employee in the planning is critical. So a flexible schedule, that's pretty straightforward. We had an employee, Don, with chronic schizophrenia that we brought into the company, and in order for Don to remain stable, he had to have weekly injections at the hospital. And because the medical system tends to not be very flexible, we had to accommodate Don, let him flex his schedule so that one day a week he started later in the day and worked later so that he could get to the hospital and have his much needed medication. And, that was 5 years ago. 2 years he was with us, and then he graduated up and out into a full-time position with a manufacturer, and he's still there today. So it was a pretty easy thing to accommodate, but without that accommodation, he would not have been able to maintain his work because the medical system was adamant that he had to be there at a certain time of day. So again, just an example of, really undue hardship. That was an easy thing to accommodate, and for a pretty serious mental illness.
Right, and just for our listeners, we want to let you know that when we do reference people, we do not say their full names, and if we do say a name, we have received permission from that employee, so just so the listeners understand. Thank you.
Yes, and thank you for that. We have a video of Don. I didn't have time to show it today, but he's more than happy to share his story. He's a good guy. Modified breaks, that's pretty self-explanatory. Job restructuring is where you can take the marginal functions of a role and redistribute them. So the person would still be doing the core duties of that role, but some of those tasks that maybe are on the outlying areas of that role can be reassigned. Mentors in the workplace can be a very natural support to all staff, but particularly those with mental illness. So this may be people in your workforce, not necessarily managers or supervisors, it could be, but it's just people in your workplace that tend to be cheerleaders. They tend to be very supportive of everyone. They check in with people. They're kind of those natural leaders, but maybe not officially a leader. That can be very impactful, having those people just kind of buddy up with somebody who may be struggling a bit. And then job coaches are more formal, and often if you're working or recruiting with a local employment service provider, job coaching is a support that can be available. Telework, this is somewhat new. It can look like flexible working space, working from home are a couple options. It is optional for some roles depending on your business, and I do realize that not all businesses can accommodate that type of accommodation. Those are just some examples. I did want to draw attention to this resource, www.askjan.org. So JAN is the Job Accommodation Network. It's a U.S. site, but it is absolutely excellent for getting specific ideas around accommodations for any disability, really. But if you type in mental health disability, it'll bring up a list of accommodations. It's a great way as employers to educate yourself, but it's also a great resource to share with your own staff so that if you have someone who has disclosed a mental health challenge, they could look at that list of ideas and decide what may or may not work for them, because at the end of the day, they know themselves better than we do. So again, having them engaged and part of that planning is really important. This is a really good site. So if your company is committed to having a mentally healthy workplace, your policies really create the foundation, and then enacting on those policies, so walking the walk right from your senior leadership to your frontline staff, living the values of your corporation, really bringing them to life, will create that positive culture of support and mutual respect. So your mission and value statements should then be embedded throughout your company policies, using that inclusive language and having respect as a theme throughout. And the key is then to uphold your policies within your business practices. So for example, around recruitment and hiring, you can be inclusive and accommodating individuals right at the beginning of that process. So your postings may have a statement that indicates you're an inclusive employer. At Goodwill, we partner with local employment service agencies with respect to hiring. So this is our mission and our mandate around inclusive hiring. And there are some very real benefits to this type of partnership. So often candidates from employment services come with additional supports, as I mentioned before, such as job coaches who can perhaps help with any anxiety or other challenges that one may be facing as they transition into your workplace. Many of them also have financial resources to help you as the employer with the cost of onboarding and training. So that's important to note that as well. When you're booking interviews, it's good to ask candidates if they require any accommodation to attend your interview. And then upon hiring, as part of your onboarding, that's the time to be highlighting your policies around diversity, discrimination, your accessibility policy, and your accommodation policy, and review the process around how an employee would request an accommodation. Review your return to work policy as well. This way you're proactively letting your employees know that you have these important procedures in place and you want your employees to be successful in your workplace. Again, I think there's that perception or fear that if you talk about these things up front, it may open up a can of worms. But I assure you, it's much better to encourage that open communication early on. We don't want to feed into the stigma that, mental illness is something we shouldn't talk about. It's a bad thing. And if we're not having these conversations, it will become quite costly down the road when this employee suddenly starts to struggle with productivity or their absenteeism because they had some mental health challenges that probably could have been supported right from the start.
And Bev, just to add on to that, what you said earlier about, having these conversations early on, we have, just looking at the list here of people on this call today, I see a lot of HR, recruitment, and human resources managers. So it's really, when Bev says early on, we're talking new hire orientations. Most of you, if not all of you, when someone starts and commences their first day of work, it's usually a day or two, or depending on your organization, half day of training. So what we're hearing from Bev is, when you're having that training and you're talking about health and safety, absenteeism policy, send policy, accessibility policy, and code of conduct, all that stuff, that mental health is part of that orientation, that it's not separate, that right from the get-go, when the person joins your organization, you're having that new hire orientation that makes sure that's included. Is that fair to say, Bev?
Absolutely. It needs to be fully integrated. Absolutely. It's not a standalone, because then again, we're creating the stigma around it if we don't fully embed it as part of our policies and procedures. Yes, absolutely.
Thank you, Bev.
With respect to metrics, if you're wanting to demonstrate the return on investment in accommodating employees, it would be good to have your current baseline data. So maybe you already know what your turnover rate is, the number of WSIB claims you have related to mental health or stress leaves, any employee feedback that you've collected through organizational surveys, related to job satisfaction, how they feel about communication in your organization, your health and safety. This all tells you a level of employee engagement in your company. So if you aren't already conducting at minimum an annual employee survey, I would encourage you to do so just as part of establishing that baseline data. Some companies are actually looking at having inclusion and diversity metrics right in their company scorecard. So for example, you may want to identify specific demographics in your community or within your community that you want to support. So some companies are intentionally looking to recruit youth or newcomers or persons with disabilities, single parents. It's whatever is important to your company, what aligns with your values, and then you want to measure that. So how many employees within your baseline data or your current workforce right now exist within those identified groups, and then over time look at your impact and then be tracking progress, look at retention across your workforce, and measuring internal promotions is another really good thing to report on, because it speaks to the fact that you are committed to growing and developing your people and your business. What is your return to work policy? How do you welcome someone back after they've been off for a mental health stress leave? So think about someone who's away due to a physical condition, or maybe they've gone off for a leave of absence because of surgery. Do you welcome them back with a card, with a luncheon? Because we should try to do the same thing for someone coming back from a mental health leave. Again, we may unintentionally perpetuate the stigma around mental illness if we aren't treating it similar to other leaves. And again, I can't stress how important communication is. You want to stay in touch with the employee during their leave, and then prior to their return, you want to let them know what to expect when they come in for that face-to-face planning session. And then when they do come in and you're planning a return to work, to have lots of open-ended questions ready so that they are fully engaged and part of the plan that's going to help them be successful in their return to work.
Right, and Bev, it's interesting. We had CMHA and a couple of guests, even from the ministry, that spoke to this very topic. The example, and I'm paraphrasing, that was used was the example was given that there was a worker, she got into a car accident, she was hit by a car, she was off for a month, overwhelming emails, the flowers were sent to her, she came back and did a cake party and said, welcome back, glad, da-da-da-da. The same worker, a year later, unfortunately, due to the injuries that she suffered, actually ended up suffering mental health issues because of that. and then took some time off, but nobody reached out to her, nobody called her. So what you're saying, and it's important for our listeners today, is that make sure you're consistent, right?
Yes.
A return to work, you have a worker who's off. If they're off on a medical leave, if they're off on a non-occupational injury through snowboarding or whatever, I'm just giving examples here, to make sure that you're consistent, that whatever your approach is, it shouldn't differ for what type of injury or accommodation. It's the fact that the person is returning to work.
Exactly. And I highlighted mentalhealthworks.ca here again because they have resources specifically around return to work plans, really practical, easy to implement. So another really good resource to just make note of. And I think, too, that the more that you are talking about mental health in your workplace, it just does become part of your organization's culture, and it gets easier, I guess is what I'm saying. It does get easier. It just becomes part of the day-to-day.
Mm-hmm.
Tips for a mentally...
Sorry, Bev, I know you're moving your tips for mentally health workplace. This is actually in junction, but I did want to just make a quick comment on the last piece that you said, which is definitely true, is people should be comfortable. If they're, I've been in health and safety and compliance for 17 years, and, some organizations, people were hesitant to report an injury. And now there's so many cultures. Are you kidding me? You're hurt? Of course we want to know if you got hurt. It's part of your obligation. Let us know what happened so we can accommodate. Same thing should be for mental health. No one should be hesitant. There should not have this stigma, and it should be fully approachable.
Absolutely. Yes. Thank you for that. Mentally healthy workplace. So with respect to recruitment, and I mentioned this before, partnering with a local employment service agency is a good practice. It's something to consider. It creates more community awareness about your company, so it can really strengthen your brand. The candidates tend to come with additional support, the financial incentives to help cover some of the costs, potentially job coaching. And then ensure that you have your job descriptions that very clearly outline the expectations of the role. We all need clarity, but having the job description very clear can really help with somebody that is coming into a new position and may have some concerns around mental health. Celebrate and recognize. I'm sure some of you are already doing a lot of this, but maybe like Employee of the Month, pizza lunches to recognize the team, maybe after a sale day, 50% off days for staff, just things that kind of reward and create that positivity in your workplace. Professional development of any kind is, very valuable. You can host lunch and learns. There's lots of free webinars. Mental health. The employee surveys. If I've mentioned that already too, if you are doing any surveys, it's a great way to get a read on how your employees are feeling about different aspects of the company. Then you want to be sure that you do something with those responses. So you want to collate, summarize, share out to all of your team members, but then how you're going to address, one or two of those hot button items that your employees seem to be feeling strongly about. Employees feel validated when their input is heard. Mental health first aid training for managers, I mentioned that. That's usually available through your local CMHA, but there may be other organizations in your community. Having community partners like CMHA come in and do a lunch and learn, do an information session at a management staff meeting, something like that. Your benefits package, we've just been reviewing our benefits package here, and there's a lot of discussion around strengthening the supports for mental health, because as companies, we do a really good job of supporting the physical health of our employees so that they have medical coverage, dental coverage. I strongly encourage you to be looking at your plans and what is in there as far as mental health supports. And then just generally promoting work and life balance. And promoting it, again, comes from leadership. If they see you as leaders, embracing that work-life balance, then people are encouraged to do the same. In Canada, it's usually 1 week in May that Canada focuses on mental health. And as an employer, you could promote this internally. You could have daily huddles with your team that are focused on something related to mental health. You could hang posters, again, have a lunch and learn maybe during that week. It's just creating awareness and reducing the stigma. Employers really need to understand and recognize the signs of mental illness. So you do have to educate yourselves, and there's some wonderful resources that I'm just going to touch on and wrap up with here shortly. But some things that could be signs of mental illness. On their own, they might not be, but it's a sign, and it's something then that you would want to follow up on. Is if somebody's struggling with attendance, if they have, they're unable to cope day to day with just the decision making of their role, hygiene issues, poor concentration, sudden change in mood. Substance use and abuse can be a sign of mental illness as well. So managers need to be aware of some of those signs so that they're recognizing that they can, again, be proactive, have those conversations, check in, make sure that people are doing okay. And the reality is that not everybody is going to be open about it. A manager may be very good at having and initiating those conversations, but it depends where the person is at. They may deny any concerns, and then you may have to look at performance management. If it truly is a performance issue and the individual is not disclosing any mental health concern, you do have a business to run, and you know, we have to respect that as well. But it's about making sure we're asking the questions, checking in with people, offering supports, and giving them the opportunity and the safe space to disclose if something has come up.
Excellent. So a lot of great insights and resources. As you can tell, there's just so much out there right now in Canada. I know you used that the American reference earlier on, but even in Canada, and again, Red Retail Council of Canada. So if there's anything specific that you're looking for, feel free to reach out to myself or Marcy, and we will definitely follow up. That was a great presentation. Was there any final thoughts that you had before I move on to questions?
No, I think we're good. We covered a lot, so hopefully we do have some questions and can have a bit of a discussion. Thanks, Sunny.
Yes, we do. Well, thank you, Bev. I'll formally say thank you and goodbye in a few minutes here. So again, just a reminder for all of our listeners, we do have a question and answer feature. So again, on your bottom right hand of your screen, you should see a question and answer feature. Just type in your question and we'll be able to answer it. So the first one, Bev, I'll read out here. Hey, Bev, great presentation. Thank you for taking the time for providing your insights. Quick question. You mentioned employee survey. How many mental health questions are asked in your survey? Okay, so it's a two-part question. So first question, how many mental health questions do you have in your survey? And then follow up, are the results shared with leadership or everyone?
Great question. We don't ask specifically questions around mental health because to do that, you could unintentionally create, you're making it a standalone then. What we ask are general questions about health and wellness in general. So that work-life balance, we try to find out from people how active they are in their community. Do they belong to social clubs? You know, do they go to church? What different activities do they do? And then questions around, do you feel you have enough time in your day or in your week with family, hobbies, those types of things. The results are shared first with our senior leadership team, and we do a little bit of an analysis around it, but it is shared with the entire company. And we kind of organize it in a way that any areas that fall below a certain score that are concerning, that need to be addressed, they're color-coded red, let's say. And the ones where we're excelling at and doing really well at are green. Areas that maybe need some improvement are yellow. And that is shared out with all of our team. And but then we have an action plan as an organization how we're going to address some of those red areas. And I can share, like, communication is always identified as an area that needs improvement. So I know a lot of us do great work with, you know, communicating and sharing with our employees, but it just never seems to be enough. So communicate. I can't stress that enough.
Excellent. So we just got a response saying thank you So just to clarify, you do not ask a question such as, do you feel our organization has a good mental health program? Okay, so they're being very specific here.
Yeah, you sure could. We haven't been that specific in our questions. We ask more around, do you feel that we have good policies that encourage, respect and acceptance in the workplace? But I actually really like that question. I don't think it's too specific. That's a great question to be asking.
There you go. You just gave some feedback to Bev and Goodwill. All right. That's good. All right, so Sunny, please don't disclose my, okay, yeah, so just to make sure we do not disclose any names or members, we just asked a question. All right, so the following question, Sunny and Bev, I am still getting some resistance from the top. People do understand the importance of this, but when it comes to training, I can barely get health and safety training for 30 minutes. How am I going to get mental health training? Any advice? Help, please.
Well, the one resource that I had listed there at the end is the Mental Health Commission of Canada. They have really good stats on their website around the business case for providing accommodation and supports to workers with mental illness. I would start there. I would build your case and use the evidence that's out there to really support why, coming up with a strategy, and it's not just a kind of Band-Aid or a one-size-fits-all solution. I think maybe propose a bit of a strategy, and maybe you just start out with some, let's say, for example, the mental health first aid training for your managers. I think it's $225 for a 2-day session for one person. Maybe you propose that, a certain number of your managers, would get that training. It's a start, but I would start with the evidence, build your case, and find some case studies that support, case studies that are retailers similar to your own business, so that it seems real, perhaps, to your senior leadership. Right. And that's where I'd start.
Great, and you got a thank you with a smiley face, so it seems like you definitely answered their question. All right, so just last round, if there's any more questions, please feel free to ask them now. And again, we totally get it. Some people don't like to ask questions publicly and would rather prefer contacting retail counsel, so please feel free to do so. Okay, last question. I got one in. How frequently do you meet with an employee with an accommodation for mental health reasons?
Great question. It's very individual. So there are some employees where we're doing weekly check-ins. There are some employees, we have one right now, a young woman who's, a lovely woman, really struggling with her depression, and we're doing a check-in every morning just to kind of talk about what does today look like, what do you need today, and because each day looks different for her. So one day she may need more frequent breaks. Another day she may actually need to break right first thing in the morning and start a little later. So it's a daily check-in. But at very least, I would say someone on a mental health accommodation at the very least once a week.
Right. And we heard in the last webinars that we've had too, is to make that very transparent from the beginning, right? So to let that worker know, hey, listen, I am going to check up on you every week or every morning, like you said. Obviously, it'll depend, but just so then the worker knows too, or the person knows too, that they'll be expecting a call, which is great. And those weekly touch-ins, the worker may come back or the person and say, hey, can we do it every 2 weeks? But as the employer, make sure you have a frequency, is what Bev's saying here.
And document it. So if you have someone on an accommodation plan, you want to have that documented, and it's an agreement between the two of you that you've signed off on, and it's coming from a supportive place. It's to help you be successful. Yeah.
That's a great point that you added in there. Yes, documentation definitely is key. All right, so we are coming up to the end of our session. So I want to thank again Bev Kobi. Great insights. Thank you so much for your expertise. Really much appreciated, and thank you for answering all of our listeners' questions today, Bev.
Thank you, Sunny. Thanks again for having me.
Absolutely. All right. So as we wrap up, I just wanted to say thank you to all of our listeners. That is officially our last webinar of the year, and what a great year we had. A big thank you to the MSAA for all their support. We definitely appreciate that. And for all of our guests that have joined us during this webinar to make this a great, informative, and insightful 2019. Just a final reminder to everyone before I end this call that all of our webinars are recorded. So if you missed this one or you missed any previous ones, please know that you will get a web link taking you to this recorded session, but also all of our webinars are on our website at Retail Council of Canada. Feel free to go there and listen in. All right, everyone, that closes our 2019 series of webinars. Wishing everyone a great and safe day.